I'm Sam from Barrie Community Media. This is a special update. On January 8th, the Simcoe Muskoka District Health Unit declared a COVID-19 outbreak at Roberta Place long-term care home in Barrie. By Sunday the 17th, 9 residents have died. And at that time, there were over 62 positive cases amongst home residents. 43 team members were infected. And those numbers are updated day by day. I'm recording this at 5 p.m. on January 18th. It's also confirmed that officials are currently testing for a highly infective strain of the COVID-19 virus. Various online sources have reported varying death rates and different infection statistics today and over the weekend. But we at Barrie Community Media can't verify those numbers, so we aren't sharing them here. But this afternoon, the Simcoe Muskoka District Health Unit announced that Aurelia's Soldiers Memorial Hospital is stepping up as a lead in organizing the response to the outbreak at the home. In a press release, Dr. Charles Gardner, Simcoe Muskoka District Health Unit's Medical Officer of Health, explained more. Quote, "The residents and staff at Roberta Place have been hit very hard with this current COVID-19 outbreak, and our thoughts are with them during this extremely difficult time. In consultation with the facility, we have determined that the support of Aurelia Soldiers Memorial Hospital is essential. This outbreak unfortunately has spread very rapidly and affected a large number of residents and staff. The leadership of OSMH, together with a number of other agencies and organizations, is necessary to bring it under control," unquote. Through it all, it's the residents, staff, and their families who are being directly affected by this rapidly worsening crisis. Debbie Grigg's mother, Evelyn, is currently a resident of Roberta Place, and she's exhibiting COVID-19 symptoms. Here is my conversation with Debbie Grigg about her mother and Roberta Place's response to the outbreak.
Can you just tell me what you know about the situation happening in Roberta Place?
Well, I know some, but I don't know a heck of a lot. So I know that they have an outbreak. I know that their numbers keep rising every day. I'm waiting today to find out what the numbers are. We get an update each day from Roberta Place on the computer. As of 5 minutes ago, they said that there were some things happening. They didn't say what, but that they can't give us an update right away, that they would do that later on this afternoon.
Oh, okay, and I'm so sorry to hear that your mother is in Roberta Place, and I was looking at some of your Facebook posts that said she was sick. So I wanted to ask, how is she doing in this situation?
So she is sick, and we still don't have her results back. The doctor and them have said that she has COVID. She got the test on Friday, and we still don't have the results back. So in regards to the COVID, I'm not quite sure how she's doing. I haven't seen her because I don't want to put her at risk by me going up and, infecting them by any way, which I don't have COVID because I go for my test every week, but and also bringing it out and possibly infecting other people. So she's doing okay, you know what I mean? But it's, I know that her temperature was higher last week and her lung capacity was low. As of today, I'm not quite sure. At Roberta Place, they seem to be having a problem with their phones, so I can't get an update as much as I would like to.
Oh, okay. And have you had a chance to speak with your mother?
I spoke with her once on the, I think it was the 9th of January that I spoke with her, because what they're trying to do is keep all the residents in room right now so that they're not out if somebody does, have it without having the test back and knowing for sure yet. So they try to keep everybody in their rooms. But on the Saturday, they had only had the one case, so I called, and my mother's very cute, so she has Alzheimer's dementia, and she thinks that she works there as well. So when I called and I spoke with the nurse, she said my mother was beside her. So I got on the phone with her and explained to her that she needed to make sure she wears her mask and that, and she said she was, and she said, look, I'm busy right now. I'm the nurse's helper today. She said, and I've got lots of things to do and lots of people to take care of, so I can't talk right now. I'll have to let you go.
Oh, okay. Well, I'm glad to know that she's in good spirits.
Yeah, she really is.
Yeah. And I was wondering, for you and anyone in your family as well who's outside of Roberta Place, how are you feeling right now?
It's really hard. It's a toss-up, like I said, of, wanting to be in full PPE and go and see her, even though if I was to go up, I can't hug her or anything else like that. But it's heart-wrenching when you see the numbers going up more and more and more each day. How fast it's spreading. You hear about the people who have lost their loved ones that have passed away. And, I don't know who they are, but my heart breaks for them. And I'm actually afraid too, even though they're not my family members, to go, hopefully after this is over, to go up and see my mom and possibly not see some of the residents that were on her floor with her that she interacted with each day. And I don't sleep well. I worry about my mom constantly.
Mm-hmm. And as far as the situation in long-term care homes in Ontario, and now that it's come so close to home in Barrie as well, how do you feel about the government of Ontario's action in terms of caring for people in long-term care homes during the pandemic?
Well, you know what? I often say that I would love to sit down and have a talk with Premier Ford. When I see him on the news, I can see in his eyes that it hurts. I can see that he actually does care. But as I've said it to my family members, he has, let's say, person A, B, and C telling him, no, we don't have to go this far. We don't have to do this. We don't have to do that. Then he's got person D, E, F, and G saying, yes, we need to do this. So he's stuck there listening to one person, listening to another, where I think that he, having I think it was his mother-in-law in long-term, should understand and realize what people are feeling, how people feel, and if it's his loved one, he would definitely want things happening right away. And I think that he should feel for us and know that we want things happening right away as well.
And as far as the staff in long-term care homes and the staff in Roberta Place, is there anything you'd want them to know? Because I'm sure they're all probably pretty busy right now. But if you could kind of speak to them or tell them something about caring for your mom or about the situation, what would you want them to know?
I would love all the staff, the PSWs and the nurses that are on Home Area 5, which is where my mother is, that I totally understand that they are overworked, overwhelmed, sad as well because they get close to all these people. They're there, 5, 6, 7 days a week as well. They're taking care of these people, so their hearts are breaking as well. I know that they are trying to do the best that they can and to hang in there. Unfortunately, they're not getting the help that they need, but hopefully somebody will wake up soon and send them the help that they need so that they can actually take a deep breath as well.
Well, Debbie, I'm wishing you and your family and especially your mom all the best in the coming days, and thank you so much for speaking with me.
Thank you so much, and you have a great day.